Hello everyone, welcome to HIM 225. In this lecture we're going to be discussing Chapter 21 in your textbook, which is Chapter 14 in ICD-10. This is diseases of the genitourinary system. As always, I want to remind you to look at the acronyms, abbreviations and acronyms in this chapter, and if you'll look on page 502, there are quite a few of acronyms and abbreviations. As I went through this chapter, in many of the examples, there are acronyms, and I actually came back to the abbreviation and acronyms to confirm what those abbreviation and acronyms were that they were using. So as we look at some of these examples, as you look at more examples, you may need to come back to that and see what they what that acronym is for. I also want to encourage you to review the glossary terms at the end of the chapter, and then also to review the questions that are your homework for this chapter. Looking at this chapter in ICD-10, we do have an excludes to note. And then when we look at the section list, there are not that many sections for this particular chapter, but I want you to notice that this chapter does include the codes for kidney function are in here, male genitalia, disorders of the breast, and then the female genitalia. So, genitourinary system. Let's take a look at the guidelines that are on page 502 in your textbook. And the first guideline deals with stages of chronic kidney disease. And we're going to click on that particular section. And you'll notice that we have a category for acute kidney failure and then chronic kidney disease. Chronic kidney disease used to be called chronic renal failure, but they renamed that. So it's chronic kidney disease, or CKD, and you very commonly will see it referred to as CKD. You won't see them write out chronic kidney disease. While we're in this particular section, you're going to notice that there's the excludes note 2 here that applies to the codes in this particular section. So let's look at N18, which is the category for chronic kidney disease. Now, you'll notice that we do have some notes up here. These notes apply to the entire category of N18. Code first. Any associated diabetic chronic kidney disease. So if this is a patient with diabetic chronic kidney disease, you're going to have the code for the diabetes first. Hypertensive chronic kidney disease. We have an entire set of extensive guidelines related to hypertension with chronic kidney disease and heart failure. You may need to look at those guidelines if you're coding a patient that has hypertension and chronic kidney disease and heart failure. Go back and remind yourself of those guidelines. And then we do have a use additional code to identify kidney transplant status, and we have a guideline that talks about CKD patients with kidney transplant status, and it gives you this code. If a patient has had a kidney transplant, Z94.0 is the code that signifies that they have had that transplant. Now, I want you to look at these codes that we have for chronic kidney disease. You'll notice that the code for stage 1 ends in a 1. The code for stage 2, which is mild, ends in a 2. Now, when we get to stage 3, there is chronic kidney disease stage 3 unspecified. But when we get to stage 3, there's stage 3A and stage 3B. Chronic kidney disease stage 4 ends in a 4, and 5 ends in a 5. Now, if a patient has chronic kidney disease, stage 5 chronic kidney disease, and they require dialysis, they are coded to N18.6, which is end-stage renal disease. And this is a patient that requires chronic dialysis. Without it, they're going to become toxic and they will die. And then for patients that are receiving dialysis, this code is Z99.2. That's their status of receiving dialysis. Then there are those instances when you may find that a patient is documented as having chronic kidney disease without any telling you what stage it is, and that code is N18.9. So it's in this day and time, it is not common to see just chronic kidney disease documented. You may be able to generate a query asking the physician for more specificity related to that chronic kidney disease. On the note of dialysis, I will tell you that dialysis is typically not a procedure that is performed in the hospital. There are specific outpatient dialysis centers that patients go to. Dialysis centers have vans, they pick up patients, they have their chair times. Patients have to be there for their chair times at those dialysis centers. We would have patients who would end up in our ER because they did not go to their outpatient dialysis. And we would end up having to dialyze them in the hospital, which is not something hospitals like to do. But they would have to dialyze those patients. And of course, those patients were considered to be non-compliant. Sometimes when a patient needs dialysis, they will come into the hospital, they will have the shunt placed, and their first dialysis encounter will actually be in the hospital, but that usually that is the only time. Some hospitals may actually own outpatient dialysis centers, but they actually will have their own provider number, and those claims will all be filed with that provider number. They are distinct from the hospital. Okay, so let's look in, I want to look in the index. Let's just try to put in CKD. Nope, doesn't come up. Okay, so let's put in, so we're going to put in disease, kidney, and then we see chronic. If it's hypertensive, then we have to see hypertension, kidney. We know that. We've looked at these codes before. And then you can see the different codes here for chronic kidney disease. If it's complicating pregnancy, then you are going to see pregnancy complicated by renal disease, and we'll go over that extensively when we are in that chapter. So as we scroll down through this particular category, it's a pretty long category, so you have to be careful when you're, not kidney, I'm sorry, disease is a long category. Kidney is not. It's really specific to these subterms. In this first example on page 502, this patient came into the hospital with fluid overload because they were non-compliant with attending their renal dialysis session. They have stage 5 CKD, and prolonged intermittent dialysis was performed. So the condition determined to have occasioned the admission was the fluid overload. In the index, we put in overload and fluid, and we see that code E87.70, fluid overload unspecified. Then we're looking at our CKD code, and we know that if a patient has stage 5 chronic kidney disease and they require dialysis, then they are coded to N18.6. Then this is a non-compliant patient. And I want you to note that in the index, we go to non-compliant and then with, and then you'll see dialysis right there. It has its own subterm. So patient's non-compliance with renal dialysis, Z91.15. Then we are also going to code, we're also going to code the dialysis. and this is hemodialysis 5A1D, and we know that this dialysis is prolonged intermittent, and so the character that we choose for this is going to be 8, and then filtration and no qualifier. I don't know why filtration's the only option, but it didn't automatically pop in for some reason. And so that's how we find this code for dialysis. And of course, duration is the character that you need to pull out from the documentation. And you'll notice this is based on time. Less than 6 hours per day, 6 to 18 hours per day, greater than 18 hours per day. Okay, so on the top of page 503, this patient had a kidney transplant last year, but they still have mild chronic kidney disease stage 2. And the guideline on the top of page 502 tells us that the reason that patients have kidney transplants is because of disease or damage to the kidney, and certainly chronic kidney disease is that key cause. And once a patient has a kidney transplant, they may still have some degree of chronic kidney disease. Just because they have chronic kidney disease after a transplant does not mean it is a complication of the transplant. You would only code the complication of the transplant if in fact the provider documented that whatever the condition the patient had, that it was a complication of that transplant. So in this instance, we're going to be coding the fact that the patient has stage 2 chronic kidney disease in 18.2, and then we are also going to add that Z code of Z94.0 to reflect that the patient has had a kidney transplant. Chronic kidney disease can occur with other conditions, and there are guidelines specific to those conditions in the chapters. In this last example on 503, patient has chronic kidney disease due to hypertension. And in the index, we go to hypertension and then kidney, and we'll see with. And then we have chronic CKD, and we see that code 112.0. Stage 1 through stage 4 chronic kidney disease is I12.9. Now, we don't have a stage documented. We are choosing I12.9 because it's not stage 5. And then we're also using the code from category N18 that indicates we have an unspecified chronic kidney disease, unspecified, because this is a very general term. On the top of page 506 in your textbook, we find nephrotic syndrome. And in this example, we have acute nephrotic syndrome with extracapillary glomerular nephritis. So if I go to syndrome nephritic, not nephrotic, nephritic, it tells us to see also nephritis. Okay, there are some subterms here, but these subterms don't really tell us that that patient has that glomerular nephritis. So I am going to, and I've always told you, if you look up a term and it says see also, always look at it, because usually it takes you to something that is much more detailed. And sure enough, when we go to nephritis, this is what we see. So this patient has extracapillary glomerular nephritis. And when we look at nephritis, we will see our options for all of these terms. We have a lot of non-essential modifiers here, so I'm looking through those. Those do not seem to apply to what I am looking for. So I'm going to go down and look at acute and to see that if it has any subterms that reflect for me this extra capillary, and I don't see any there. So I'm gonna go to glomerular nephritis. And when I get to glomerular nephritis, I have a subterm that says extracapillary NEC. It says see also NOO through NO7 with a fourth character of .7. And then it also has this code NO7.5. I'm going to look at NO7.5. I'm sorry, we need NO5.7. Unspecified nephrotic syndrome. Ours is not unspecified. It is acute. So let me look at this category of NOO through NO7. And if I go to NOO, what I will see is NOO.0, acute nephrotic syndrome. And as I scroll down through these codes, I can see acute nephrotic syndrome with diffuse crancentric glomerulonephritis, and it says that this is acute nephritic syndrome with extracapillary glomerulonephritis. Now, what a way to have to find that code. So sometimes you really have to dig to try and find these. And of course, this is the documentation. This is the term that we're looking for right here with this code. But I wanted to show you this because sometimes it is, I'm not sure why they don't make this a little more clear to find, other than if you're coding these patients and you're familiar with coding patients that have kidney disease, that you will know that diffuse crancentric glomerulonephritis is extracapillary glomerulonephritis. On the top of page 507, the first example, minimal change glomerulonephritis. So if we go to glomerulonephritis with, if we try to put in change or minimal change, we don't find anything. But under with, we find minimal change, N05.0. And here is that code. So now in the next answer question, we have RPGN. RPGN, what is that? I'm going back over to abbreviations and acronyms, and I'm looking at RPGN, rapidly progressive glomerulonephritis. And so in the tabular, I have glomerular nephritis. And I can go to glomerular nephritis, rapidly progressive, N01.9. On page 508, in this first example, patient has VUR with neuropathy of the right kidney. Well, what's VUR? Well, on the previous page, it told you that it was vesico-urethral reflux, but you could also look up VUR in the acronyms. So in the index for this, I'm looking up reflux and then vesico-urethral with, and it is unilateral because it's just the right kidney. So the code is N13.721. In this next example, we have hydronephrosis due to ureterolithiasis. Okay, so I looked up ureterolithiasis, and you can see that it tells me to go to a calculus of the ureter. And we can see with hydronephrosis, N13.2. So as we look at this code, and one of the things I haven't been doing is going to the beginning of the category and apologizing. I want you to always do that. And I've done it as I've gone through and prepared for this lecture. But we can see that we have an excludes note here, and this is hydronephrosis. And this is a code that reflects that the patient has obstruction and infection. So if in fact they had those conditions with this hydronephrosis and calculi, you would need to use that code. Okay, so let's look at, on page 509, let's look at this first example. The patient's admitted with an exacerbation of congestive heart failure. The patient is also in acute renal failure. The physician documents that the acute renal failure is due to the patient's fluid overload. So let's talk about what's going on here. This patient has congestive heart failure, and because they're in congestive heart failure, they actually were not diuresing, and so they developed fluid overload because of the congestive heart failure, and then because they had fluid overload, they developed acute renal failure. So when we're considering our principal diagnosis code here, it's easy to say, oh, well, the renal failure is the most acute thing. That would be the principal diagnosis, but that is not the case. They only have acute renal failure because they went into fluid overload because of the congestive heart failure. So on admission, they admitted the patient to treat that exacerbation of the congestive heart failure, which will involve diuresing that patient so that they lose that fluid, and that will resolve that acute renal failure. I have seen patients come in and be diuresed and lose 30 to 40 pounds of fluid. So when we're coding this, the congestive heart failure is sequenced first, and then we have the code for acute renal failure. In the next example, we have acute renal failure due to dehydration. Well, patients can certainly be dehydrated without going into acute renal failure. In this particular example, the acute renal failure is the condition that occasioned the admission. It's sequenced first, and then we have the code for the dehydration. Your textbook then goes on to talk about chronic kidney disease, so make sure that you read that in that section. I'm looking at page 511, urinary tract infection. Urinary tract infection, UTI, this is a general term that describes the infection of any area of the urinary tract. However, there are some terms that are more specific. So cystitis is a lower urinary tract infection. Urethritis is an infection of the urethra. But UTI is commonly used when physicians are referring to cystitis, urethritis, or even pyelonephritis. These codes are assigned based on the site of the infection if it's known. So if a patient had cystitis, you would only assign the code for the cystitis. So the UTI code, N30.90, in ICD-9, that's the first one that pops in my head. It's 599.0. But let's go in and look at N39.0 is the default code for urinary tract infection. And you can see here that clearly that it says site not specified. You also will use an additional code for the infectious agent. So if they do a urine culture and it grows out E. coli, then you're adding a code for E. coli. Now, I want to point this out to you very carefully. If a patient has a urinary tract infection that's due to candidiasis, you are not using the code M39.0. You are not adding a code for candidiasis. You are using this code B37.4. This is candidiasis, and then you apply the code for the appropriate code. If it's cystitis and urethritis, it's documented as cystitis and urethritis, B37.41, balanitis, B37.42, but if all they tell you is that it is a UTI due to candidiasis, the code is B37.49. Your question for this lecture is exercise 21.3, and it's question number 1. So 21.3, question number 1 on page 511, and I'll continue with chapter 21 in the next lecture.